Good afternoon, and thank you so much for joining our very last minute urgent update for the outbreak period. My name is Casey Hope. I'm the Director of Marketing and Communications here at MedCom Benefit Solutions. We certainly appreciate your time this afternoon. We're going to try to present some information regarding the outbreak period, some updates that have come out, but please know that this information is very new. We are getting updates every day, sometimes multiple times a day, so information does change, but we will try, as always, to keep you as up to date as possible. Just to let you know, this is being recorded, and we will be able to send you a link to that recording and the slide deck afterwards. You can also download in the handout section a few of the talking points that we're covering today. Michelle Barkey, our senior legal counsel, is here to kind of talk about what's happened in the last few days regarding the outbreak period, and she typed up some of her talking points so that you would be able to access a little bit more in-depth information. So feel free to download that from the handout section. And as always, we will be having a Q&A session at the end of Michelle's presentation here. So please feel free to submit your questions in the questions panel, and we will do our best to answer and address those at the end. So without further ado, Michelle, I'm going to turn it over to you.
Well, thank you very much, Casey, and welcome everybody to our urgent update for the outbreak period. As they say, sometimes they say, you know, more things change, the more they stay the same. That has not been true with COVID. Things are changing on a regular basis, and we just all need to keep up to date as to what's been going on and why. Basically, if you remember last year on May the 4th, the agencies, the Department of Labor, the Treasury, and the Department of Health and Human Services established the outbreak period due to COVID. Basically, the departments were given the authority years ago by Congress that during a period of a national emergency, they can suspend certain time frames that are typically in a law, and in order to accommodate the national emergency. So that is exactly what they did. And they said basically what would happen is from the period from March the 1st of 2020 to the end of the national emergency, and 60 days after the end of the national emergency, they established this outbreak period, and it basically told certain deadlines that needed to be required. So basically consider this, as you know, consider this period just suspended, and nothing needs to happen during this period. And it did affect all ERISA plans, and the Department of Health and Human Services for the state and local governments did ask them to adopt it under the Public Health Service Acts, but it was not mandated because they didn't have the authority to do so. But it did affect all ERISA plans. And basically, as we said, the period between March the 1st of 2020 through 60 days past the end of the national emergency could not be considered when determining enforcement and notification of certain things that are in our ERISA plans. And those certain things were special enrollment timeframes. So for an example, if you had a child that was born, and the child, you would typically have to put the child on the plan in 30 days or 60 days in certain circumstances. That was told between March the 1st and 60 days past the end of the national emergency. So that, you know, still today, you probably can enroll that child that was born during that period of time into a plan without any penalties. It really affected COBRA because they also waived all the timeframes for COBRA. So for an example, anyone who lost their job in January, they would have 60 days to elect COBRA from the date that the notice went out or from the date that coverage was lost. So that potentially got tied up in this outbreak period if they needed to elect any time after March the 1st of 2020 through 60 days past the end of the national emergency. And that also meant for payments, the first payment would have been due in 45 days. That was suspended. And then for all those individuals who are already on COBRA, their payments could be suspended as well. Now, it didn't mean that they would get their claims paid, because the claims were all suspended until the monies came in. COBRA notices, we also had a relief from that you didn't have to send out COBRA notices in those timeframes that were generally provided. A lot of COBRA administrators did. We at MedCom certainly tried to keep it on the same schedule. Claim procedure timeframes. Okay, so you've got a claim and it's typically due within so many days of the a time frame, to submit a claim. And we certainly know that with runout periods, there are time frames that you must submit a claim. You must submit a claim for medical within a certain time frame. All those time frames were also suspended. And then the external review process, if a claim was denied, those were all suspended as well. So this outbreak period, as a refresher, did expand a lot of time frames, and it created a lot of havoc over this past year. So let's just talk a little bit about the different emergencies. The national emergency is not the same as a public health emergency. The national emergency has to be declared by a president, and President Trump did so on March the 13th. And just as the national emergency has to be declared, in order to end, the president has to say, it's done, we're finished, we don't need it anymore. All indications are the national emergency will not be declared over until the end of this year, until the end of 2021. Now, a national emergency could be for anything. It doesn't just have to be because of a pandemic. It could be if we had a really bad hurricane, a really bad terrorist attack, whatever the emergency is, we declared war. Whatever that emergency is, it would be declared by the president and then ended by the president. A public health emergency, on the other hand, is declared by the Department of Health and Human Services through rights that were granted to them by Congress. But the public health emergency has to be reviewed every 90 days. And it was actually declared by the Department of Health and Human Services on January 27th of 2020 and has carried over ever since then. The public health emergency affects some of the provisions in the CARES Act. For an example, as long as we're under a public health emergency for COVID, COVID has to be covered with, with no co-payments and everything up until including diagnosis, and vaccines have to be covered at 100%. So those are the two different types of emergencies. Again, the national emergency is still going on, and the public health emergency was just extended again as well. So we've got these two emergencies out there, and the national emergency is one that dictates the outbreak period. But here was the crunch, and a lot of people did not catch this. MedCom started to talk about it early in February, and it was, except for a few different organizations, people thought I had a horn on my head, like, what are you talking about? But basically, for the Department of Labor to make a regulation like they did for the outbreak period, they certainly have the authority under a statute provided by Congress that's codified under 29 USC section 1148. But it only gives them the authority up to a year. And the same with the IRS code. The IRS can declare certain timeframes extended as well. But again, their authority that was granted to them by Congress under 26 USC section 7508A subsection B can only be declared for up to a year. When they declared the outbreak period, nobody thought that the national emergency would extend beyond a year. And yet here we are. March 1st is a year from the outbreak period. So we were starting to talk about, hey, the outbreak period is going to end on February the 28th. And at the end of February, that's when all the tolling would stop, and COBRA, people would have to elect COBRA within 60 days and pay premiums within 45 days. And all the individuals who kind of held off paying their COBRA premiums, if they wanted to bring their COBRA up, they would have to pay it all within the grace period, which would be by the end of March of 2021. That is exactly what happened. The IRS and the DOL began to realize that the authority of the outbreak period was terminating. And all of a sudden, we started to see around mid-February that there was a lot more chatter on the internet about, is this outbreak period ending? But we never heard from the IRS or the Department of Labor. They never came up to us and said anything. And we realized that they didn't have really the authority to continue it. It would have to be Congress. And Congress certainly are trying to pass their relief bill, but this was not part of it. And they certainly never proceeded to pass any law that said, we will now adopt the outbreak period, which Congress would have the authority to do, but the agencies do not. Reasons agencies do not have the authority to go beyond what Congress said is they're not elected officials. They're agencies, they're bureaucrats, and they cannot go beyond what Congress gave them the authority to do. So here we are, the end of February, now we're the 2nd of March, and the outbreak period has expired. So then the next question is anything going to happen from the Department of Labor or the IRS? And, you know, the original hintings were that they weren't going to do anything. But then the DOL came up last Friday, February 26th, knowing we had a weekend, the 27th and the 28th, and they came up with a new rule for the outbreak period, trying to squeeze it into the authority that they actually had. So basically what they said is that they were going to individualize the outbreak period so that we wouldn't look at the, March the 1st of 2020 through February the 28th of 2021. We would look at the individual and when the event happened. And then we would go a year from that date on the individual basis for the tolling, or if the national emergency ended prior to that, it would have to stop 60 days after the end of the national emergency. So it got very convoluted, very, very fast. So we are now looking at the individual. So let's give a couple of examples. If a qualified beneficiary would have been required to make a COBRA election by March the 1st of 2020, that year for that individual does expire on February 28th of 2001. They would then have, depending on, it looks like they would not have the 60 days because they would have had to make the election by March the 1st. Now they have 45 days in order to make the first payment. If the election was due, however, on March the 1st of 2021, they would have until February 28th of 2022 to make the election, as long as the national emergency did not end. And now they're saying, and then with the national emergency, if the election was due by March the 1st of 2021, and the national emergency ends on June the 1st of 2021, they would then have 60 days to make the election, or July 31st of 2021, which is the 60 days. You couple this with when premiums are due, you couple this with special enrollment rights, you couple this with claims procedures, and you can see how now we are not looking at a drop dead date of February 28th. Now we have to look at every individual and where they fall in the year and where their year expires. And the DOL says, we can do this because we're looking at it, but it's not more than a year based on an individual. Casey, can you turn the slide? So basically that's the way it is ending there. I think Casey might be having a little bit of trouble turning slides. So the next thing that we have to talk about is what do we need to do in order to make this work? And there's different things that come up, and they basically said, look, where the plan administrator or other responsible plan fiduciary should reasonably know that the end of the relief period is due, then we need to certainly look at giving notification to the individual. So we have to look at that 1 year date and let the individual know this is when we might have to let them know that this is being done. The second one is, Casey, I think we passed that slide. The second one is if plan disclosures were issued prior or during the pandemic, then we need to reissue them or to amend them. And then further, if group health plans should consider ways to ensure that the participants and the beneficiaries who are losing their coverage, that they understand that the marketplace is a place where they can go. And just to make that very clear, the President Biden did open the marketplace again, and the marketplace is now going to be, the federal marketplace is going to be opened on May 15th until May 15th, so you can go ahead and enroll in the plan by May 15th. And he also let the states that run their own plans to know to run their own plans and to potentially open it up to May 15th. And at least 13 states have done that to date, including the District of Columbia. And then the other thing they said is that plan fiduciaries should make reasonable accommodations to prevent the loss of undue delay in the payment of benefits, and should take steps to minimize the possibility of individuals losing benefits because of failure to comply with pre-established timeframes. We don't quite know what this means, but we're almost wondering whether or not that the IRS and the Department of Labor are thinking, well, you know, you should always look at the individual situation and determine what we need to do in order to keep them covered, or we need to get them to the marketplace or whatever. Again, it's not clear everything that what we do know that this is going to be done on an individual basis. And again, if the DOL or the Department of the IRS expect us to keep people on the plans or do whatever we need to do, of course, the first thing we need to do is talk to the plans and see whether or not they are going to allow this to happen. And of course, the reinsurance carriers and whether they would allow it. Again, this is very new as of Friday, and things are still coming down. Now, some other information that just came down as far as interpretation is concerned, and it is mind-boggling. But now they're also looking at whether payments have a year to be paid. So for an example, let's look at that individual who needed to, who was already paying COBRA, and then on March the 1st decided they would put everything in abeyance and take advantage of this tolling, so that on March the 1st, the premiums would become due from 2020 and to, you know, basically February 28th of 2021 to bring them up to date. And then every 30 days moving forward, they would be completely up to date and up to speed for the 18 months. Now they're saying potentially the way this is being interpreted is that when they pay their March 20th, 2020 premium by the end of March of 2021, they would then have another year to pay the April premium. So the April premium for 2020 would not be due until April the 30th of 2021, and so on and so forth. So not only would we be looking at the individual, but in COBRA, we might be looking at the payments dragging out for a year in arrears up until the time the national emergency ends, or they catch up with the 18 months, or they decide what they're going to do. So this is getting really, really confusing. The notice is very, very recent. We're still working with it. We're still looking at it. We're trying to figure out the notices that we have to provide to individuals. We did provide individuals notices of the outbreak period. Now we've got to go back individually and look at who, you know, is in what part of the year and how we are going to get that done. So again, this is very, very new. It just came out. And then on top of it for COBRA, the government, when they passed that Relief Act in the House, it hasn't passed the Senate yet, but they also had a COBRA subsidy in that. And that COBRA subsidy would be a very short subsidy between April the 1st and September the 30th of 2021. It would be for everybody that was on COBRA. The individual would pay 15%, the employer would pay 85%, and then get it reimbursed on a payroll tax basis. Again, it would be mandatory if that comes out. So a lot of things are going on with COBRA. The outbreak period itself does affect special enrollment rights. It affects everything. Everybody is trying to get their handle on this. But again, the DOL and the IRS never expected the outbreak period to go this long. And then all of a sudden they realized that they lost their authority. And now they're trying to make up for lost time. And they only did it as of last Friday. So we're all kind of scrambling, but we wanted to bring you up to date as to what information we have and what's going on. Casey, do we have any questions?
Oh, do we?
Yeah, I can imagine. And I want to preface this, we might not have all the answers.
That's true. We may not, because as Michelle just said, all of this is very new. It's new to us. And I will apologize. I've had a little bit of a technical difficulty. So if at any time, Michelle, I'm not coming through, I'm going to turn this over to Derek Ashton, who is with us, but we can handle that if the problem arises. So our first question, we'll go ahead and get into these questions. Let's see. What if a health insurance carrier is not allowing special enrollment if the change is not entered in the system within 30 days from the qualifying event date? They've been doing this for the past 6 months.
Wow. The carriers were supposed to follow through with this outbreak period as well. It certainly is an issue if the special enrollment rights, the carriers are not allowing it. And if it truly is part of the outbreak period and is not, potentially a government entity or a government entity or, subdivision. But again, the IRS and the DOL put the onus on the plan sponsors, does make it really, really difficult. But I would go back to the carrier and say, this is what is required with the outbreak period, and what are you doing? And this added burden is just going to hurt even more.
Absolutely. So anyone who had to make an election between March 2nd of 2020 and March 1st of 2021 would have until 2022?
If the election had to be made by March the 1st, they would have until 2020 of 2020, and it's a special enrollment right, so it's technically 30 days to enroll the baby. So let's say the baby was born on March the 1st. They would have February 28th would be the year, and then they would have until March 31st or 30 days, March 30th to put the baby on their plan. If the baby was just born now on March 1st of 2021, yes, they would have until February 28th is when their year period would end, and they would have 30 days after March the 1st of 2022 to enroll that baby, unless the national emergency ends prior to that. And then they would have 60 days past the end of the national emergency is when the time frame would stop, and then the 30 days. So yes, it gets very complicated, but you've got to look at the individual and the time that the individual is at.
Are the special enrollment rules extended on individual policies, like for newborn?
Yeah, for the newborns, it's part of the outbreak period. So yes, it is extended.
Okay. If the regular COBRA premium is due on March 1st of 21 and is not paid on time, can the employer terminate COBRA, or do they have to wait for 1 year to keep that person active on the plan, even if they're not paying for COBRA?
That is a really good question, and I will tell you that has been debated since the beginning of the outbreak period, because there was very little guidance by the Department of Labor and the IRS. But basically what they did say is that the employers do not have to pay the premiums, and the individual and the claims do not have to be paid during that period of time. A lot of the carriers came back and said, you know what, we are not going to retro term an employee, so that if you keep them going as an active employee and you've been paying us the money all the way, all the way around on this, because you've kept them active, we're not going to retro terminate them. That's it. Except we'll go back 60 days, but no more. They said they would much rather retro add them, so that basically what a lot of the COBRA administrators were doing is that they would be terminated in the system, so no monies was being paid. But if they came back and paid the monies, it was automatically re-enrolled without any question or without any documentation as to why they were late, and if it was an excusable reason, it was just automatically reinstated. But that's been an issue since the beginning of the outbreak period.
Gotcha. I know that we've talked about that several times, Michelle. What flexibility or options do non-ERISA groups have in regard to offering or not offering these timeframe extensions?
Again, these timeframe extensions were for ERISA plans. The Department of Health and Human Services did encourage the states to adopt them for those that were under the Public Health Safety Act. They said, please do this. So it all depends on your state and what your state did. Gotcha. And how the state's going to interpret this, and whether the state's going to go on and do the same thing.
So this is kind of a two-part question, Michelle. How does this impact the runout period extension for FSA plans?
Again, the FSA plans are probably going to be the easiest to administer because most of the FSAs do not have a runout for terminated employees. So you would just look at when the runout period was due to expire. So for example, if a runout period was due to expire on April the 1st of 2021, that's when it was due to expire, then they would have the time frame after that to have the runout period commence and run. So if it was a 60-day runout period after April the 1st, the tolling would start. If the runout period was due to expire on March the 1st, then they would have the 60 days after March the 1st, or whatever the runout period said. But again, you look at the individual runout period, and it's a year from that date, plus the time of the runout.
So is the 2019 runout period still available for participants to file claims for reimbursement?
Probably not. Let me think about that. I have to go in my head and calculate. So if somebody in December of 2019, the runout period would end in 2019 would be December of 2020. It would go to, because the authority lasted until March the 1st. So March the 1st is when they would commence their 60 days. Or 90 days or whatever it is.
Gotcha. That's some quick on your feet math there, Michelle.
I have to look at that one a little bit more carefully, but.
Okay, and if we're able to provide extra guidance on that, we can reach out. We can reach out and let the person who asked that question know.
But typically the runout period ended in 2019. I mean, the runout period didn't commence until March the 1st, so it would probably be gone unless it was a very long runout period. It would probably already have terminated before we come into year 20.
Do you think the 2020 FSA runout period will also be extended?
The 2020 runout periods, yeah, I mean, it all depends on where that runout period ended. You have to take out March the 1st of 2020. So any period from March the 1st of 2020, you go a year, and that's when you would start the runout.
I gotcha.
So you take a month, and you go from the runout.
does the outbreak period extend to does the outbreak period extend open enrollment too? This person has employees who declined benefits during open enrollment, but want to enroll now, but I don't have any qualifying life events.
Okay. That's going to be a whole other conversation that we're going to have on Thursday, because we are going to be talking about the Consolidated Appropriations Act of 2021 and some new IRS guidance about open enrollment periods, special open enrollment periods, and all that. But that's not under the outbreak period. That's under the Consolidated Appropriations Act. Stay tuned on Thursday.
That's right, and we can provide, once we send out the information after this presentation today, I will happily provide a link for anyone to register for that webinar Thursday at 2 o'clock that doesn't have access already. Can you clarify the amount of premium subsidy being considered?
The amount of the premium subsidy being considered is 85%. The employee would pay 15%, the employer would pay 85%, and the 85% that the employer would pay would be claimed on their payroll tax.
Thank you. Taking the HIPAA special enrollment example of the baby that you mentioned earlier, what if the baby was born on February 1st of 2021? Would they have 1 year from that date?
If they were born on February 1st of 2021, yes, they would have 1 year from that date plus the 30 days in order to, because the period of time for a year would be carved out. So they would have a year carve out, then the 30 days would commence, unless the national emergency ends prior to that.
I gotcha. So this person has a TPA that also handles FSA, and they've refused to recognize the extension of timelines that applies to the health FSA. What are TPAs required to do?
They should be following the timelines.
I gotcha. What is the latest an employee can elect COBRA if their COBRA coverage was supposed to begin on 9/1 of 2020?
If their COBRA coverage was due to begin on 9/1 of 2020, then it would go to, I mean, if that's when the date that they were supposed to, pay their first premium, it would go to, or the date that they were supposed to elect, because we have to look to see whether they elected or not. But if the election date they were supposed to elect was September the 1st of 2020, then it would go to August the 31st of 2020 during this carve-out period, and then they would have they would have to elect within that would be, so they were supposed to elect because they've already had their notice, then they would have a year to elect, and then 45 more additional days to pay. So it all depends on where they stand in, if they've already elected, if they didn't, but periods are carved out. So we'd have to look at more specifics in order to determine exactly the dates. You guys are giving me a run for my money with all these dates.
I was thinking the same thing, Michelle. You're a miracle worker. I could never do that. Won't the allowed delay in enrollment encourage anti-selection in that some people who didn't have any claims may not enroll, while only those with health issues will enroll?
Oh yes, you can expect adverse selection for sure. But isn't COBRA always full of adverse selection where people, even on a normal basis, determine whether or not they're going to have any claims during the period of time that they are, able to elect. And then if they didn't have any claims, then they have new coverage, that's when they elect. So COBRA's always had a little bit of adverse selection, but oh yes, you're right, more adverse selection. And the other thing with COBRA, don't forget, is anybody can pay a COBRA premium. So it gives those individuals who might have had a serious medical issue and they can't pay the COBRA premiums. It gives those the providers that might have incurred high costs on them to elect COBRA for them. So yeah, adverse selection is very real in this situation. But the government's not thinking about that. The government is thinking about covering people.
Absolutely. It sounds like that if the carrier goes back several months to reinstate a member's COBRA, they would have extended claims submission deadlines.
Yeah, and don't forget those submission deadlines are also part of the outbreak period. So they would then have the time to go back and pay the claims as well.
Okay, did you say that each month of past due COBRA premium also has a 1-year example or extension? For example, if I was COBRA eligible in March of 2020 and I finally elect in March of 2021, would I owe retro premiums for the last 12 months? But I do not have to pay all those at once, or do I have to pay all those at once?
Well, that's the debate right now. The debate right now is, by the way it's written, some are saying that you would have a year from the time the premium was due, so that what you would pay for March of 2021, from March of 2020 would be March of 2021, April 2020, April 21. So this is something that's up for debate. It's just something that's being thrown around today, that this might be another issue. And I thought I would bring it to your attention, but it's something that has not been clarified by the Department of Labor. But by the way it is read, some people are reading it to be that the premiums would be due on a monthly basis and not all due up front. Fun, huh?
So, somebody has said this is a knowledge overload, and I would have to agree. It's a lot of information.
It is. And nobody expected the national emergency to last this long. And the Department of Labor and the IRS kind of missed the boat too. And they didn't give us any guidance as to when they lost their authority until Friday afternoon, just before it happened. So yes, you are completely right. The outbreak period caused us a nightmare. And I think I have a migraine from the just thinking about this new part of the outbreak period. And as I say, my phone has not stopped ringing, and the lawyer community in Narissa is out there, and everybody is trying to put out stuff. But it came very suddenly.
We have one more question here, Michelle. Can you clarify the applicability to local government entities? So are COBRA extensions not applicable to local entities like like the extension to special enrollments that are optional?
The Department of Health and Human Services didn't have the authority under the Public Health Act to say, hey, this is what you have to do. So basically what they said is we strongly encourage it. And then it's up to the states to say what they did. So you have to look at state by state.
Got it. As of right now, we don't have any other questions. Just want to say thank you for tuning in. Thank you for being patient, but thank you mostly for trusting MedCom to provide you this information. Michelle, thank you. Derek, thanks for standing by to help out as well. If you have any follow-up questions, here's our contact information. Feel free to reach out. And as I said before, I will provide the slide deck from this and the handout information that kind of goes into detail a bit more about what Michelle talked about. And I'll provide the link to the webinar on Thursday afternoon at 2 p.m. So please stand by for that. We will be sending that out as soon as possible. So everyone, again, thank you so very much. Michelle, Derek, and everyone, have a great afternoon.
Thank you.